Hello everyone. In this brief session, we are going to speak about Botox and another name or the generic name for the Botox Botulinum Toxin. I am Dr. Khalid Hassan, Associate Professor of Clinical Pharmacology, Drug Therapy, and Clinical Research. As introduction for the botulinum toxin Botox, botulinum toxin defined as a neurotoxin produced from bacteria, produce a toxin called Clostridium botulinum. We have several type of botulinum toxin. Could be type A, B, C until H. The popular use in medical practice, we have botulinum toxin A and B used in medical practice and in the cosmetic process. So as we discussed, we have two main types for botulinum toxin, type A and type B. And for type A, the brand name Botox or Xeomin, and used for muscle spasm, migraine, hyperhidrosis, wrinkle reduction. So for the muscle pain, if the patient suffers from neck pain or low back pain, or like wrinkles, or like hyper sweating, like severe sweating, or like hyper maybe sweating on the palm and the feet, could be used to reduce sweating. Type B, myo block here. For type B, used for cervical dystonia when you have a spasm on the neck or related muscle contraction disorders. How this medication work? Botox or botulinum toxin in general, this medication inhibit acetylcholine. Someone may ask, what is acetylcholine? Acetylcholine considered like a neuromediator released from the neurons, from the nerves and the brain on the spinal cord. And this acetylcholine responsible for binding to the some type of component on the cell surface, and this type called receptor, and this specific type of receptor called nicotinic receptor. So acetylcholine bind to the nicotinic receptor and cause activation, and this activation lead to the something called depolarization, action potential, and skeletal muscle contraction. So acetylcholine, for simplicity, acetylcholine responsible for skeletal muscle contraction. Okay, and our medication here, Botox, our medication prevent release of acetylcholine. For this reason, prevent muscle contraction. So acetylcholine cause muscle contraction. Botox prevent acetylcholine release. Therefore, the result will be muscle relaxation or sometimes paralysis. What are the clinical uses of botulinum toxin? As you can see, we can use botulinum toxin for treatment of neurologic disorders, chronic migraine, type of headache, hyperhidrosis, like severe sweating in the palm and feet. Could be used for cosmetic application, wrinkle reduction. So we have it in the several application in the clinical practice. A little bit more detail about the clinical use of botulinum toxin or Botox or MyBlock. As you can see here, we can use it for patients from cervical dystonia when they have maybe a neck muscle spasm, they cannot move their neck, and we call this one cervical dystonia. Blepharospasm, when they have a spasm around the eyebrow and they are not able to focus and read. Spasticity, this one like any lesions or any disease related to the central nervous system, such as multiple sclerosis, such as cerebral palsy, such as stroke, for example, and the patient due to these disease suffer from spasm or spasticity, we can use botulinum toxin for this purpose. We can use it for patients suffer from migraine, and we use Botox. They found the reduced frequency of attack of migraine. For hyperhidrosis, as you can see here, they said it's like reduce or treat the excessive sweating. We can use it in other cosmetic application for wrinkle reduction, for the frown lines, for the crow's feet and the forehead lines. Also, we can use it for this application. Let us discuss the safety and adverse effect, safety and side effect. What they found here, injection of Botox may cause pain, injection site pain, may cause headache, may cause flu-like syndrome. Sometimes we can see serious side effects such as muscle weakness, difficult swelling, and respiratory issue. So, because the acetylcholine is important for our body, and this medication prevent release of acetylcholine, and this medication, this Botox botulinum toxin, should be administered by maybe individual with a special trained, experienced, professional people enabled to deliver this medication to the patient. At the end of this short session, thank you so much for listening and have a great day, everyone.